Morning guys, so today we are going to do the second stage of the Osce exam, which is planning, and we are going to make a care plan for a patient who came to the emergency department with severe breathlessness, fever and productive cough. She is now stable and has been admitted to the medical assessment unit, and we need to make a care plan for two relevant aspects of nursing care and self-care suitable for the next 24 hours. So let's get started. The first and foremost thing we need to write is nursing problem. So the nursing problem would be Mrs. A is experiencing breathlessness with a respiratory rate of 28 breaths per minute. Aim of care will be Mrs. A will verbalize relief from breathlessness with a respiratory rate of 16 to 20 breaths per minute. And reevaluation date would be to be reevaluated today's date, every hour, and if her clinical condition change. Okay, so the first thing after that we have is care provided by the nurse and self-care activities. We'll do the care provided by the nurse first. So we are using Amatarad method, but just keep in mind for E it's explain, M for monitor, A for assess, T for teaching, and A again administration of the medication, then R as referral if we are going to refer her, and I for any instructions you want to give her, and the last one is documentation. Okay, so we'll read it one by one. The first one, explain and discuss all aspects of care to Mrs. A and gain consent for every intervention. The second one, for M, monitor and record Mrs. A's observations and especially her respiration and escalate as per the news score. Number 3, we have assess Mrs. A's breathing pattern and monitor for signs of respiratory distress such as cyanosis, labored breathing, and drowsiness. Number 4, teach Mrs. A deep breathing exercises and repositioning techniques for optimal lung expansion. Number 5, administer to Mrs. A her prescribed medications and monitor the effectiveness. Number 6, refer Mrs. A to respiratory specialist nurse if needed. Number 7, instruct Mrs. A the proper use of call bell and place it within her reach. Number 8, document all Mrs. A's care as planned. Now we're gonna move to self-care activities. Number 1, Mrs. A verbalizes understanding of her plan of care and gives consent. Number 2, Mrs. A actively participates in the plan of care. Number 3, Mrs. A demonstrates deep breathing exercises and repositions self for comfort. Number 4, Mrs. A properly uses the call bell when needing assistance. Self-care activities you can repeat in the two problems because in the exam you are going to write two nursing problems, right? So this was the first one. Even these self-care activities you can write in the second nursing problem. That would be fine. That's absolutely fine. And there are some points in the care provided by the nurse which can be repeated, like the first one, explain and discuss all aspects of care. This is a very common one, so we can use it and it's 100% correct. Okay, and this the next one is administration of the medication, which is also we can use it in the different nursing problem, and referral also we can use it, and document also. So basically you need to have 2 or 3 nursing care provided by the nurse according to the scenario, but the rest they remain same in all the nursing care provided by the nurse in all the problems. Whatever you get in your exam, whether it's breathlessness or chest pain or risk of infection, risk of hemorrhage, the basic ones you can write in every nursing care plan. All right guys, if you have any questions please let me know, because I'm preparing for my exam also, so maybe it's helpful for me to learn and for you guys also. So good luck if you are preparing for your exam, and if there is any questions you can always ask me. Thank you so much.